As I said this morning, that's probably the downside of having good testing, is you find a lot of cases that other countries who don't even test don't have. If you don't test, you don't have any cases. If we stop testing right now, we'd have very few cases, if any.
Wait, what did he say?
If we stop testing right now, we'd have very few cases, if any.
Anyway, so today we're going to talk about the second wave of the COVID-19 pandemic and is it safe to go back to work? Local governments all over the country are starting to relax the lockdown and quarantine rules that had been going on for the last few months in an effort to boost the economy, get people back working, and all that's super understandable. The flip side is, are we causing danger, are we causing risks to our citizens by rushing everyone back to work, getting back in these close confines, and are we gonna have a second wave of the COVID-19 pandemic? And when people think about COVID-19, the two things that come to mind were the Spanish flu way back in the day, where the second wave was actually worse than the first and even more devastating. And then a little bit more recently, we had the H1N1 bird flu, where the second wave was also pretty bad. Dr. Anthony Fauci recently said that the Memorial Day celebrations and the protests in the wake of George Floyd's murder were the perfect recipe for a spread or a second wave of COVID-19. This makes a lot of sense when we think about what we know about the virus. We know that it loves urban settings because people are so close to one another. We know that it likes moisture and things like tear gas and all the things that the police are throwing at protesters create that moisture and aerosolization in the air, making it easier for the virus to spread from one person to another. And obviously it's impossible to socially distance yourself at a protest, or very difficult to at least. And the protests are happening in a lot of the major cities that are epicenters of COVID-19 as well. So all these things together make the perfect storm for there to be a second wave. I don't want to get anyone confused at all into thinking that I was against the protests in any way. I absolutely think we need to protest. This is one of the rare situations where the benefit from people being in this close proximity, where we can create lasting, impactful change on policies that have been brutalizing the people of our country for so long, are worth the risks of increasing the rates or causing a spike in COVID-19 cases. But that being said, it doesn't mean that there's not going to be a spike in cases because the moral cause was right. We're still going to have to deal with the aftermath of all these people being in such close proximity. Most professionals in the field right now really don't see any way of avoiding a second wave. Because on one hand, you would need either a vaccine or complete social distancing. And we know that a vaccine is still a ways out, and even if it were to come out, the chances that a large percentage of people would trust it and all get vaccinated is very low. And then we've already reached summer where people are having fun, they're excited, they're back to work, back to making money. To take people away from that is going to be nearly impossible unless, people in their families are all starting to get COVID-19. That may adjust how people look at it ethically and morally, but more than likely, the fun and economic benefit of the summer is going to outweigh people thinking about what if and the risks of COVID-19. Now, the only way, the loophole to this would be is if people say, well, there's not going to be a second wave because we never even exited our first. And that's likely true. If you look at the graphs of the United States versus other first world countries, you see that they've truly kind of plateaued all the way down to very minimal cases per day, where we've never actually made our way back down to that. So the only way of really saying that we'll avoid a second wave is that we've never even exited our first. I think the scientific community lost a lot of trust in the public when it kept going back and forth, flip-flopping on, first it was the masks, whether or not we should be wearing an N95 mask or a normal surgical mask. Then it went to no mask versus yes mask. Then it went from around 6 people to 10 people to only you and your family. And then it was, we have these anti-malarial drugs that work. Oh wait, no, they don't work. Or flipping people over in the ICU is working, or it's not working. And then so many back and forth that now the public thinks that these government agencies that are controlling healthcare have no idea what they're doing, and they're not completely wrong about a lot of that. In fact, many doctors are frustrated as well over the flip-flopping of these guidelines, hoping that we can be a little bit more patient before putting out guidelines so that we don't have to flip-flop back and forth and kind of start regaining that trust. But because there's so much pressure from these agencies to have constantly updating guidelines, those forces are going back and forth against one another. At the end of the day, scientists and doctors are gonna have to compromise between getting things out quickly and coming up with the right scientific method to come out with treatments and cures like they usually do. And to answer the question if it's safe to go back to work, now this really depends on so many different factors. First, the overall health of the person that's going back to work and their age, and then what the environment is like for that person at work. So for instance, just think of it as a curve of jobs are going to be either have a high likelihood of transmitting COVID-19 or low. So if you work in a hospital setting or a crowded proximity place, those are going to be high risk jobs. And if you are young and healthy, you're going to be a low risk person of going back to work. And if you are older with many comorbidities or other diseases that you're dealing with, you're going to be a high risk person to go back to work. And now you just have to balance those two things. So someone that has a high risk medical history, going back to a high risk job, that person should not be going back to work. The young healthy patient going back to a healthcare environment is likely going to be more safe, though we see many people young and healthy having severe outcomes from COVID-19. And the young and healthy patient going back to a job like working on a golf course where they're not going to be in close proximity to people is likely the most safe, the best option. I would consider them safe to go back to work. But remember, that just means they have the lowest risk. So even if you have a 1% risk of something, that means that it can still happen to you. No one is free and clear of anything. And of course, the small business owners who feel like their whole livelihood is at risk if they don't get people back into their businesses, that's a tough ethical question, because for some people, their complete economic stability is almost worth their life. And that's the unfortunate way of thinking that people get into in capitalist societies. We think that money is everything. And all too often we've seen people commit suicide because of financial hardship. And this next part, I repeat over and over and over again to both patients, peers, and everyone, just a reminder that medicine is a game of probability. Everything we do is to try and get the lowest possible chance of something bad happening to us. And similarly with coronavirus and battling the COVID-19 pandemic, that's what we're trying to do. Every time you put on a mask, we're not saying that the mask is going to prevent you from getting COVID-19, but it's going to lower your probability. Then when you add washing your hands on top of that, that's going to continue to lower your probability. Then if you stay at home and not leave unless you have to, that continues to lower the probability that you will contract COVID-19. And you can do all these things right and still unfortunately get COVID-19 and have bad outcomes from it. And you can do everything wrong and still end up not getting COVID-19. But your chances of that happening are very, very low. Just like the man who smokes tobacco every single day for his entire life and doesn't eat anything but bacon and whiskey and doesn't have any lung cancer or any cardiovascular disease. That's very, 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 very rare, but there is gonna be one or two people like that out there. And then there's gonna be the people that eat vegetables every day, run every day, and still end up with some bad health outcome. But the chance of them getting that was very low, but unfortunately they did. So you wanna put yourself into the bucket where you have the best probability of having the best outcome. But in the back of your mind, knowing that you have to be prepared for anything at any moment. I hope this answered a few questions. Thank you for your time. Be safe out there, be healthy, exercise your body, exercise your mind, learn something new. Have a beautiful day.